Right, 17 minutes to go before we say bye-bye to you here on Morning Live. The KwaZulu-Natal Health Department has dismissed claims by the Democratic Alliance that due to poor conditions, 5 major hospitals in the province will be placed under national administration. The allegations come amid the department's investigations into media reports that a patient's body was eaten by rats after it was left unattended in a ward at the Nkonjeni District Hospital in that province. So to discuss this further from our Durban Studios, we're joined by the MEC for Health in KZN, Dr. Sibongiseni Dhlomo. MEC, thank you. Thanks very much for joining us here on the program.
Good morning, Leanne, and good morning to all your viewers.
Yeah. MEC, let's get straight to the point. Your department, together with Mpumalanga and the Eastern Cape, they faced Parliament yesterday over the state of health services. In his budget vote, Health Minister Dr. Aaron Motsoaledi also said that the department is in a state of crisis. Would you say that is a good way to describe the health department in KZN, a state of crisis?
I did not go to Parliament yesterday. I'm going today. There was a reschedule, as you probably might have picked up, that the Deputy President of the country was in KZN yesterday on the TB conference. So they really rescheduled my visit to Cape Town to take place today. We do face challenges, Leanne, but those challenges are not insurmountable. One of the biggest challenges is actually related to the actual funding of the department. I could give you an example. When you look at the population of KZN, we should be having 1,000 ambulances that would take care of all our patients, all our citizens. Mm-hmm. Right now, we have half the fleet because of other budgetary pressures. If we were to buy all 1,000 ambulances, because an ambulance costs about 250,000 rand a vehicle, and therefore you have to put an equipment weight costing 800,000. So it becomes already 1 million worth of a vehicle.
Yeah.
And now, if you were to do that, then you must shut down other services. So you make do with what we have in all other pressures. Among other things that our employees are complaining about is not filling in the vacancies on time. Among other things, we are not doing that is probably because of budgetary challenges again. You are correct that there is an incident that we're investigating. I don't have full details as yet, where a corpse was actually cleaned up, ready to go to the mortuary, but was left for about a few hours in an area called a scullery at Nkonjeni Hospital. We would want to check why there was a delay. But sometimes we are aware that some of these hospitals have got a shortage of porters, and therefore a job that should have been done in an hour gets done after 2 or 3 hours.
Yeah.
So those are some of the issues that we need to challenge ourselves and see how we actually improve on.
MEC, you describe them as challenges. If I may just have a conversation with you here, we'll chat to one another and try and get somewhere. You describe just those few things that you mentioned. I haven't even gotten into a lot more detail. You call them challenges. From what I am picking up, this is a crisis. A body eaten by rats at a hospital is a crisis, MEC. That's not a challenge. A scullery, leaving a body in a scullery for a good couple of hours because you have a shortage of porters, this shouldn't be happening. There shouldn't even be rats there. If your hospitals were clean, if they were areas that patients and people are trying to heal and receive medical treatment, but there are rats there, this is not a good enough answer for me. It really isn't. And I can only imagine that the family who want to be respected for their dead, how can they be feeling right now?
We don't condone it, Leanne. We don't condone it, Leanne. We are aware and that we are going to investigate. But all I'm saying is that when we took a decision that we are going to focus mainly on what we call critical posts, which is nurses and doctors. That was not a right and a comprehensive decision to make, because again, you don't fill up posts related to porters, clerks, and cleaners. And now, do we have to have a clean hospital? Now, you can't say you want to have nurses only who would look after patients, and when the patients die, the corpses must still be attended by the nurses to the mortuary, and again, the nurses must clean the floors. So it was actually an oversight on our side, countrywide, to say we will concentrate on filling in critical posts. Yeah. And critical posts, now we need to learn, and that's why we've brought a new dimension to say what are the critical minimum establishments per institution that must not be undermined. We mustn't have a hospital without cleaners, without porters, without clerks, because it's not good enough to have medication, but it takes you 4 hours to see a nurse or a doctor because there's no clerk there. Yeah. So we don't want to condone that. Those are issues that we need to continue overall sort of rearrange. It was a decision that we need to revisit, not just of health, but of a provincial decision, of a provincial fiscus. If there's not enough money, you are allowed to only hire nurses and doctors. And we now know that that is not a correct decision. We need to revisit that, not just as health, but as a provincial government, because we took this matter. When every time you are told in a provincial meeting that Department of Health is going to overspend by 1 billion, then you must actually go back as a health to say, where are you going to cut the spending so that you don't have that 1 billion overspending? So that is a decision that we need to take back to cabinet and say, these are issues now that are cropping with us. A particular hospital now does not have a cleaner.
Yeah, MEC,
does not have a porter.
Okay,
we need to revisit that.
But there are certain norms and standards that you need to follow. I mean, I'm talking about the basics here. So we can explain all of this away and take it and blame it on everybody. But there are norms and standards, and I'm not only bringing up an incident where a corpse is eaten by a rat. I'm bringing up another instance, and I'm going to bring up two, so you can take them all at once. You yourself were brought to tears when you walked into a hospital and you saw patients lying on the floor and sleeping on benches. And the hospital I'm talking about here is at the Scotland Hospital in Tugela Ferry. You were brought to tears, MEC, from the conditions that you saw there. A. B. We're sitting at another place where, yes, again, norms and standards need to be followed. You, in fact, were brought in front of the South African Human Rights Commission because there is a waiting list of 12 months for anybody in a KZN hospital to receive patients a treatment for oncology and for cancer. This is basically sentencing them to death because you have the machines that are not being used and nobody's able to use them. These are basics. Please, MEC, I'm finding it difficult to understand this. Perhaps you want to explain that to us.
Yes, Leanne, on the second one, it's the volumes of patients that we see. Is the volumes of patients that we see in a province. We are also supporting part of the Eastern Cape, the eastern part of the Eastern Cape, Mozambique and Swaziland. They bring patients to us. And sometimes you may not be aware, some of the patients that are being assisted privately now will, when the medical aids get finished, immediately come to government for assistance. We also don't turn them away, so the list becomes bigger and longer. But that, Leanne, is probably going to change as of yesterday, as you might have picked up that, yes, we have now the fully functional machines at Eddington that were broken. We had the president of Varian himself here in the country from US, and we also have Dr. Nkwanda Zuma, who's now going to champion that program there. But that one oncologist in that institution is not enough. We also would want to tap on the Vets Health Consortium team that is already at Nkosi Alpert to assist us on that area. That part we think we are going to turn the corner and reduce the waiting times for patients as of yesterday. Okay. But on the other incident, yes, this was actually an oversight, which is actually somebody must be disciplined, because we made it a very strong case to say these are patients who are far-flung areas who have to visit the bigger hospitals like Nkosi Alpert to the Grace Hospital once every month. Now, they need to be taken care of. When they visit those at district hospitals, they must just be given an ordinary ward. Sometimes some of them come with their own supper and get a coffee and then they sleep there. Now, when I went to that hospital unannounced, I found that the patient who had a cancer going for review was sleeping on it, and she was even not able to sleep on the bench. And I actually asked why. They said, no, they've just not painted the room where they're supposed to stay. I said, but that is not good enough. No. So sometimes you make instructions and send it down there, and it does not filter down there, but then somebody must be charged and be disciplined for not actually doing that. We had already put that as a policy. All patients going for bigger hospitals must be given that extra care support in their district hospital.
Okay, just finally, MEC, and and I know that I'm not going to get into the debate of 5 hospitals that have the DA say have or should be placed under administration of the national department. You have said that that is not the case. It's not happening. So we'll wait to hear what the finding is on this. But you say that somebody should be charged and somebody should be held responsible or accountable for things that are happening at the hospitals. Unions are saying, you're the person who should be held accountable. You should resign, because it's not that your health sector in KwaZulu-Natal is in a crisis. It's almost as if it has completely failed the citizens of KZN. What is your response?
Leanne, when you actually send instructions to, we have about over 70 hospitals with capable members to help us. That is why the issue of the DA is actually a lie. The situation, as discussed by the minister with us in provinces, that we shall be sending teams in various hospitals in the country. We report to the minister to say, look, one of the issues that we have with audit outcomes in that and this area is because we don't have a very strong team in that hospital that is managing finances. In this other side, we don't have a strong team that is doing supply chain, and that's why there's a delay on this and that. In this area, we do not have a very strong team on HR. So the beefing up is about 200 member staff from the head office, from the Minister Mswaledi. That is all over the country, not just in KwaZulu-Natal. And it is out of reports that we submit to say, look, can we get some other people who are going to come and strengthen our capacity here and there? So if you were to say the MEC must be in all hospitals, in every unit, I'm not skilled to deal with issues of finance, the issues of supply chain, but you then ask for capacity to go and capacity and support our staff in various areas of the corners. When you issue instructions to the head of department, you always hope that it is filtering down there. And when you do the monitoring and evaluation, you do find that it's happening in other hospitals, but some other areas it's not happening.
Yeah, MEC, thank you for your response. And we unfortunately have to leave it there. We've got to say goodbye on the program shortly. So that's our MEC for Health in KwaZulu-Natal, Dr. Sibongiseni Dhlomo, talking to us about the state of health in KZN. Let's take a break.